through the internet. We talked about all the websites there. It's dominated by the anti-vax movement. So I'm just going to finish up here, just a quick study here in Kazakhstan that we conducted last year. This is my public health program students. And we found that most reported sources of information for mothers and fathers on vaccines was the internet. Remember, this is a qualitative research, so the fact that about half of them reported that they primarily got their information from the internet is kind of frightening. Second most reported source, the second most reported source of information for mothers and fathers and vaccines was their physician or pediatrician, often a pediatrician. And finally, a total of 29% of the mothers, and it's qualitative research, meaning it does exist here. We don't actually know the actual percentages because it was qualitative research. And 43% of the fathers had negative or neutral attitudes towards vaccines. The fact that we had that many fathers and mothers who had negative or neutral attitudes towards vaccines was problematic, was a concern. Now, the only opportunity we have to change this situation is to educate our primary caregivers, to educate the physicians and the nurses and the people in the health system that actually have direct contact with people. And we see this in the literature as well, because we're not going to win on the internet. It's very difficult to win the battle on the internet. So personal relationships matter. Trusting relationships matter. So because clinicians' recommendations influence parental acceptance of preventive care, primary care clinicians play an important role in the success of immunization strategies. Again, another paper, the healthcare professional is a key element to transmit information, resolve doubts, and increase confidence in vaccines. Perhaps a stronger statement is coming from the European Academy of Pediatricians, who said public activities of a small minority have significantly influenced an uncertainty among the general population about both the safety of and the necessity for vaccination. Therefore, the European Academy of Pediatricians calls for greater publicly available, scientifically supported information on vaccination, particularly targeted at healthcare providers. To counteract the anti-vax movement, we need our primary care providers, the people who have direct contact with people in the community, to build trust, rapport with the patients, to be proactive about vaccine information, especially in antenatal programs, but not only antenatal programs, because often it's the father that's saying, no, this is dangerous, I don't want my child to be vaccinated. And it's the mother that goes through the antenatal program. So proactive, persistent link to the internet, put these physicians, put the health system on the internet, educate primary care physicians, nurses in knowledge and communication strategies, and then also do research on anti-vax dynamics and counter strategies. Now the challenges I'm just going to go through is this is some studies that we conducted in Armenia, which I was involved with on behalf of UNICEF, so it seems appropriate we would be providing this information today. This is a formative research on perceptions, attitudes, and practices towards immunization and introduction of new vaccines in Armenia, a qualitative study. Now, so a couple of things I want to point out. These are among teaching staff at medical universities. They say sometimes healthcare professionals do not have enough information about vaccines. And here it says these groups of healthcare providers who are against vaccines, there's a small group that are always opposed to vaccinations because of their lack of information about vaccinations. There were trainings about vaccinations, especially for polyclinic staff in recent years, but misinformation about vaccinations still exists. It still exists. The doctors are concerned also that they'll be blamed if something goes wrong with the vaccination process, that they'll be held responsible. And finally, there are a number of physicians in Armenia that actually state that they refuse to vaccinate their children This was a physician in Armenia. Said they only receive vaccines against polio. They refuse to vaccinate their children for anything else. My children, likewise, the next person, refused the other vaccinations other than TB and polio. And this person, another physician, will probably refuse all vaccinations except polio. The only reason they talk about polio is because they know the history of polio. They know what happened with polio. But they don't recognize the importance of vaccination against all these other childhood diseases. So, again, the policymakers in Armenia emphasize that we need to work more with healthcare providers, and the Ministry of Health must organize training of trainers to train primary healthcare professionals. It seems the best avenue, the best approach to counteract this anti-vaccine information. Just want to close up. I just go past this. So don't give up hope. There's always hope. And we have a responsibility to try to do something with the anti-vaccine campaign. That's what I want to say. Thank you.